All right. Well, good afternoon again, and thank you for joining me today. I'm really proud to provide you with a review of what is truly a historic budget in terms of its investment in the health and well-being of Ohioans, and not just through our department, but for Governor DeWine's cabinet and his focus on mental health and addiction prevention, harm reduction, treatment, and recovery overall. It's been quite a process, but today we have great news to share, and I want to start off by thanking you, um, all of you, for your partnership in helping us plan for the initiatives and the policy work that was put forward in this budget, and in advocating for the issues that are important to the Ohioans that we all serve together. This budget reflects their needs, their concerns, their challenges, but also their hopes. And we will continue to keep Ohioans living with and recovering from mental illness and substance use disorders, problem gambling, at the center of all that we do, and wake up each morning with purpose to achieve the best outcomes possible and to help secure the promise of the bright future that the governor has laid out for us in his vision as well. So as we move forward here, I want to take you through key budget highlights today. This portion of today's presentation will be in listen-only mode, and I'll take questions at the end. So if you have questions, please submit them through the chat, and be sure to identify yourself and your organization so that we can answer your question now, but also follow up with you if necessary. First and foremost, I want to emphasize that we are not quite 72 hours past the budget being signed. And so there are still some details that we're working through, not just at our agency, but as an administration. So today's webinar is not meant to be the all-inclusive answers to any questions that you may have, but it is really to make sure that as quickly as possible we could highlight and celebrate with you the successes that we've achieved together in this budget. And then we'll be following up over the next days and weeks with more information about specific initiatives. But I encourage you still to ask your questions, and we will certainly do our best to answer them today, or definitely answer them as we move forward. So, you know, we're blessed to have a governor who understands that health and wellness are truly a foundation to the success of families, to growing communities, and to a thriving economy. And this is Ohio's time, and this is our time. And those are Governor DeWine's words. This is something he truly believes, that we are here to make sure that we're working together to build a healthy, hopeful Ohio and achieve meaningful outcomes for Ohioans living with mental illness and substance use disorder. He presented the General Assembly with a bold vision, and I'm pleased to report that we came out of the budget process with significant wins for the people that we serve. We thank the General Assembly for the time and interest they took to understand the vision and our goals, and to achieve real results for real Ohioans, and to trust us with these resources as we work together to implement now the programs and policies that were provided to us with this budget. This work will take time. It will not happen overnight. But we have a strong foundation to build on, and we're focused on growing more of what is achieving real results today. The budget that Governor DeWine introduced focused on bold beginnings for Ohio's youngest residents, supporting healthy people, renewing communities, and really creating the best conditions for a thriving economy. Most of our work, of course, falls into these first two categories, but it is very foundational for the last two categories as well. The growth and vitality of our communities and our economy rely on having healthy Ohioans, and that is people who are healthy in all ways, including mental health and the prevention, treatment, and recovery from substance use disorders as well. So in order for our state to succeed, we need Ohioans to be at their very best. The governor outlined for our department his behavioral health priorities at the beginning of the year, and that was growing our workforce, increasing research and innovation, and building community capacity for care. I'm not sure if you were able to see the governor's press conference yesterday, where he and the lieutenant governor outlined the budget priorities and highlighted the the work that was accomplished through the budget and that we'll be implementing over the next 2 years. But mental health, behavioral health was part of what he chose to highlight at his conference yesterday, press conference yesterday. And so I think that's important for us to know. These pieces of work, workforce, research and innovation, growing community capacity, these are being lifted up by the governor on a daily basis, and will continue to get his attention and support. Outlined here on this next slide, you can see the budget priorities. We shared these with you when we introduced the budget, and these priorities were directly informed by all of you as our constituents and the Ohioans that we serve, people of all ages. As we do this work, we know that listening to the people who are receiving services and building out solutions that are meeting their needs are the most important part of our responsibility. I'm really proud to say that all of these budget priorities, as outlined by us, as introduced by Governor DeWine, were able to carry through to the final version of the budget in some form, and in many cases, fully funded. So really exciting to see how much investment and support we got for the initiatives that you identified as top priority. On the next slide, you can see here's a look at our budget by fund group. And GRF and the dedicated purpose funds, the internal service fund, those are the ones that are really managed and supported through the General Assembly's deliberations. The federal funds are sent to us from largely SAMHSA, but other federal agencies as well, and it contributes to our total budget, and we have spending authority for all of these funding sources through this budget. The dedicated purpose fund includes one-time expenditures like the ARPA Pediatric Health, the State of Ohio Action for Resiliency Network, or SOAR Network. So you can see the change between year 1 and year 2. It's largely because one-time funds were awarded through this dedicated purpose fund line item. On the next slide, you can see a look by our line item categories. And so you can see the total allocations in each of these lines over the next 2 years. So we'll dive into some of these a little more directly in the coming slides. So building 988 suicide and crisis response. This was a huge lift from the beginning. We've not had state level funding for 988 suicide and crisis lifeline before, and this was an opportunity for us to provide Ohioans in crisis with an appropriate behavioral health care response, connect them to the needed supports close to home, and reduce the burden on local law enforcement and emergency departments. You can see here that we did secure $46.5 million for the ongoing operation of 988 and crisis services in a dedicated purpose fund line item. And that is not one-time funding or one-year funding. That is split over the 2 years. We also have flexible funding to help grow Ohio's local crisis services and the infrastructure there through those locally identified needs and gaps that provide Ohioans with an appropriate response and safe place to have their crisis needs met. And there was $40 million allocated in that. And you can see here too, real results for real Ohioans. You will see this on each of these slides, and we will be updating key performance indicators for all of our work from the department, highlighting some of them on a dashboard moving forward so that we can follow our progress with the investments made in our work. We can follow the outcomes that we're getting, the results that we're getting for Ohioans as well. So more to come on that, but that's what's noted on these slides too. This is what we've achieved over the past biennium. We'll be looking forward, setting goals and measuring those over the biennium in a transparent way. Growing a strong and supported workforce, there is nothing that I have heard more as I've traveled the state and in my national travel too than the behavioral health workforce crisis that exists across the country, certainly here in Ohio and communities throughout the state. So in conjunction with federal funding allocated for workforce initiatives, our budget contains funding to support the recruitment, retention, and contemporary practice needs of behavioral health professionals in the ways that you see outlined here on the slide. We are committed to our centers of excellence, which are training grounds. We'll be doing that work in collaboration with our Behavioral Health Workforce Technical Assistance Center. And we'll also be you can also see there's an investment here in pediatric inpatient and residential settings, the workforce needed for them to serve children and youth. That $50 million in ARPA funding, it's one time, will also help us finance some of the residential treatment programming and development for the next biennium as well. And you see that on the next slide, the enhancing pediatric behavioral health. We have the need to increase capacity for treatment for children with serious behavioral health conditions and the most serious behavioral health conditions so that they can recover closer to home and closer to family, and we can reduce out-of-home placements and out-of-state treatment transfers that families are relying on today. So you'll see this investment in building the pediatric behavioral health workforce in both inpatient and residential settings, and also enhancing residential treatment environments. We are lifting up the psychiatric residential treatment facility model here in Ohio, PRTFs, in collaboration with the Department of Medicaid, Developmental Disabilities, Jobs and Family Services, DYS, Education, Health, and more. And we're doing this so that families don't have to pursue this intensive, secure treatment in an out-of-state placement. So more on that coming in the next few months, but these dollars help to stand that service up here in Ohio. You can also see that we are promoting mental health awareness and resiliency to help all Ohioans achieve their full potential. And this budget lifts that up in some very specific ways. Prevention, early intervention, and suicide prevention priorities from Ohio's Suicide Prevention Plan are being supported through this budget to increase the number of Ohioans trained to recognize warning signs and promote protective factors, resiliency, reduce stigma, specifically for those populations in Ohio that are most at risk of suicidal thoughts, behaviors, or attempting suicide. We're also working to expand Ohio's Student Assistance Program, and this is being done in collaboration with the Ohio Department of Education, which is now the Ohio Department of Education and Workforce. And we'll continue to work collaboratively with them and Miami University and the Ohio School Wellness Initiative there to implement this student assistance program framework and evidence-based practice with student wellness coordinators, and really helping to use data and implement programs that are most meaningful at the district and school levels. We'll also be, with that, there is a $1.2 billion investment through the Ohio Department of Education and Workforce that's been committed to school districts and to support that programming for non-academic barriers to success. And this current budget builds on that, that level of investment, but also increases accountability for these dollars and requires them to use 50% of the funds for student health and wellness. So very excited to see that. It also really does allow the dollars to be carried over for 1 year after receipt, and expands the use of this so that behavioral wellness coordinators can be financed through these investments of state dollars as well. We're expanding inpatient access for acute level care, so inpatient psychiatric care. We're expanding the hospital bed capacity in our state hospitals, ensuring that hospital staff and patient safety are top priority, and alleviating stress that's placed on adjacent systems such as jails, courts, and emergency departments. We are growing the hospital capacity by 30 beds and adding staffing support in our hospitals. We're also leveraging our public-private partnerships by having access to beds available in privately operated hospitals for vulnerable Ohioans who don't have insurance coverage. We expect that up to 3,000 Ohioans will be able to access inpatient care with no or reduced wait time because of this enhanced capacity and partnerships between the state, local ADAM boards, and the private sector hospitals as well. We're also expanding jail and forensic services. This budget prioritized partnerships and investments with our criminal justice partners and really to benefit those Ohioans who are justice involved and have mental health and addiction needs. We'll see treatment and recovery supports with enhanced forensic center capacity for court-ordered evaluations and monitoring and continued supports for Ohio's specialized courts and dockets. We're also improving the ability of jails to offer addiction services and medications, mental health services, and psychotropic medications to help Ohioans receive the care they need with the goal of reducing recidivism and increasing public safety. And this budget also authorizes jail-based competency restoration services. So the revised code was silent on this before, but now it's enumerated in statute that jail-based competency restoration and evaluation is something that's permissible and will help really relieve some pressure on jails, courts, and help with the efficiency of the due process experience of the men and women who are relying on that service. The budget more than doubles recovery services for Ohioans. So excited about this opportunity. I was this morning at a recognition ceremony for women in recovery, and just to hear the value that they received from peer support, from stable housing opportunities, from the ability to pursue education and employment, to reconnect with their families in healthy and meaningful ways. That's my inspiration each day. And I appreciate the recovery community stepping up and letting us know what resources were needed to make sure that we're creating these recovery opportunities around the state. We will be able to continue to grow coordinated community treatment and recovery supports for Ohioans living with mental illness and substance use disorders. The goal is to achieve wellness and reduce costly hospital admissions and jail stays, inpatient types of care. I think I've said it most recently as no longer really thinking about symptom management, but aggressively pursuing recovery and creating those opportunities for every Ohioan, regardless of their age, to live their best lives. You'll see continued funding for adult access to wellness. That project was formerly the multi-system adult work, and that helps adults with serious mental illness connect to needed resources like housing, transportation, medication, and employment supports. Also expanded funding for peer recovery organizations, recovery community organizations, clubhouses, and youth peer support across Ohio. So lots of good stuff happening in this space, and really excited about these partnerships. You'll also see in this budget increased housing options and enhanced quality as well. Supporting quality housing options for Ohioans living with and recovering from mental illness and substance use disorders is a top priority for our organization, and I know it is for all of you as well. We were able to increase the residential state supplement, RSS, from a budget of $16 million a year to $24 million a year. That takes that subsidy from $1,100 a month to $1,600 a month, really creating better opportunities for the environment and the services and supports that adults with serious mental illness who qualify for RSS receive to go to the next level in terms of quality and promoting their recovery. So grateful for the investment there. Growing quality recovery housing across the state, continued investment there. Continued support for community transition programs that are helping people with mental illness and substance use disorders who are leaving Ohio's prison system successfully re-enter into the community upon release, and to find connection to recovery, treatment, and all of the services and supports that they would need to sustain the gains that they're making. Kickstarting innovation and research for wellness and recovery. The governor has talked about the need to not just accept that what we have is the best that there is to offer to Ohioans, but to dig deeper through research and to get to the root causes of mental illness and substance use disorders, and then to work to get new discoveries into practice, just like we do with cancer, with heart health, with other diseases and conditions. The creation of this SOAR network will harness the collective effort of innovators from across Ohio to engineer the next generation of strategies to improve behavioral health outcomes for Ohioans. So we want more Ohioans to have better outcomes, and we want those outcomes to be achieved faster. That's our goal. That's the stated need here. The State of Ohio Action for Resiliency Network, the SOAR network, will develop, evaluate, and implement increasingly effective mental health and addiction prevention, treatment, and recovery strategies. It will be guided by a state advisory board that's representative of Ohio's diverse people, communities, and interests that will be collaborating on research, practice, financing, and policy developments. This will include a number of sectors, including employers, behavioral healthcare, artificial intelligence, technology, first responders, child welfare, educators, workforce developers, insurance, faith leaders, civic organizations, big tent, right? Housing developers, criminal justice. Most importantly, again, family members, youth, and adults with the experience of behavioral health conditions. This is about going upstream and creating transformational change in our system so that we can keep residents healthy and well, so that they can be successfully employed, provide for themselves and their families, and contribute to their communities. This work does begin with the establishment of a state advisory board and the development of a strategic research agenda. So we will be doing both a long-term study and smaller studies related to this strategic research agenda, and we'll be looking for innovative practices that we can lift up and implement more quickly to get, again, more Ohioans getting better outcomes in a faster way. We have several key policy initiatives that we lifted up through this budget as well. First, to promote the safety and well-being of people served by our department. We are regulators of hospitals, providers, and residential facilities. And so policy changes in this budget will require applicants for licensure or certification to be in good standing in Ohio and all other jurisdictions where the applicant operates. This includes in-state and out-of-state. This budget also puts language in effect that requires national accreditation for all certifiable services and supports, and that is by the bill's effective date for initial applications, which is October 1st of this year, and then by October 1st of 2025 for renewal applications. So 2 different dates. Organizations currently regulated by us in Ohio will have 2 years to implement this. New organizations applying for the first time will need to do so starting in October of this year. This bill also requires all mental health, alcohol, and drug addiction treatment providers to be certified by our department unless exempt under state law. We also see here some policy changes that give county courts better cash management authority so that they can manage their indigent driver alcohol treatment funds. Those are IDAT funds, you may call them. And they've just been difficult to manage, so we made some changes to make that more efficient. It also combines the psychotropic drug reimbursement program and the jail medication-assisted treatment reimbursement program into one program, the behavioral health drug reimbursement program. Again, providing more flexibility to counties for treating people with behavioral health conditions in county jails. And we're also ensuring the quality of recovery housing in communities around the state by requiring our department to either certify recovery housing or accept accreditation or from a national accreditor or its equivalent of the service of recovery housing. This would include today the National Alliance for Recovery Residents, National Quality Standards, Oxford House, or any other organization that is designated by us to be certified, meet national quality standards for recovery housing. This begins on January 1st of 2025. So the work begins now to help recovery residences meet those standards over the next year and a half. An update on veto messages. There were a couple of veto messages in our space that I want to help you understand a little bit better if you're curious here. The first was encouraging the development of promising new treatments. This was actually veto number 1. This budget prioritizes the health and well-being of Ohio veterans and first responders. And this veto is specific to Ohio's transcranial magnetic stimulation program. The budget language that was arrived at conference committee included some language that made changes to the program in a way that would have delayed the FDA's approval process on the clinical trial that is currently underway in Ohio and would potentially create a disruption in the state's progress on making this treatment more widely available. And so with collaboration with the language sponsor, the senator sponsoring this language, this veto was issued so that we can continue to make progress with Ohio's transcranial magnetic stimulation program. The second, protecting personal information of Ohioans served by Medicaid. This was veto number 33. The use of individuals' personal Medicaid information is strictly regulated by the federal government, and the proposed statute requiring the Ohio Department of Medicaid to widely share sensitive patient-level information is problematic and unnecessarily risky. So we will continue our efforts to make data available and transparent for planning and for program management responsibilities in a way that is connected to the Department of Medicaid's responsibilities with this data. And then also ensuring the quality of behavioral health services provided in Ohio, veto number 34. Federally qualified health centers are a highly valued component of Ohio's behavioral health network, providing essential health care to Ohio's underserved areas and populations. But a proposed certification exemption that arrived at conference committee would have limited Ohio's ability to ensure all providers meet certification standards that ensure consistent, high quality services in specialty behavioral health care. And for that reason, that item was vetoed as well. This budget also made several changes to Section 340 of Ohio's revised code. And these changes, you can see them on the slide here, reflect parts of Senate Bill 105 that was introduced this spring and outside of the department's 340 review work group. That work group will reconvene this year, will continue to look at Section 340 of the Ohio Revised Code. And the work that has been done over the past biennium has been really instrumental in laying a groundwork for how changes to this section should be approached and envisioned. So stay tuned for more information on our reconvening of that work group later this summer. But Senate Bill 105 was addressing parts of Section 340 of the Ohio Revised Code outside of this process and in a way that many of these sections were contemplated over the previous biennium. And so these provisions were included, and you can see here what they are. And many of them affect the operations of the department, of ATOM boards, and of provider organizations. So watch for more to come on guidance on how those will be rolled out. Other behavioral health highlights from across the administration. As I said at the beginning, Governor DeWine's passion for advancing mental health and addiction prevention, treatment, and recovery supports is not limited just to our department. You can see that through his commitment through Recovery Ohio and how other departments are engaged in this work. There are significant investments across the administration of behavioral health, and I'm so grateful for the collaboration that exists across state agencies and in partnership with all of you from those state agencies as well. A few examples are highlighted here. This is not exhaustive of all of the investments in behavioral health, but you can see here the Ohio Department of Education, now the Ohio Department of Education and Workforce. I touched on student wellness and success dollars earlier, but there's also a provision in their part of the statute now that requires mental health training for athletic coaches. So really great to see the expanded awareness and competencies around identifying signs and symptoms earlier and getting people connected to the right resources, especially Ohio's youth. The Department of Higher Education is continuing critical investments in mental health supports for students on our college campuses. During the pandemic, Ohio and our college and university partners, we were the first state to invest in student wellness on campuses with some of the dollars that were coming to the states in the early days of the pandemic. And so building on the successes there and through other initiatives that we have underway in partnership with higher education, you can see this critical $20 million in investments for the mental health and wellness of students on our college campuses. We also have the new Department of Children and Youth. There's more to come on this for sure, but this is an opportunity to consolidate those programs and services most focused on children and youth, particularly early childhood, but really across all ages. And this work has been led by the Governor's Office of Children's Initiatives. There's a transition team that's already underway and starting to put the roadmap forward for this transition to the new department in place. More on that to come, but very exciting to see this focused effort really lifting up the governor's priority of making life the best as possible for Ohio's children, youth, and families. So excited to see this work. And then the lieutenant governor's focus on social media and the policy work that he's leading around parental notification through that act. This serves as a warning label for parents about the potential dangers of social media platforms for youth and children, and it protects their rights as parents. So this is really aimed at children and youth under the age of 16. We know that very young children are using social media at this point, including, infant or toddlers, really, early preschoolers, early elementary school, who are using social media for video content and other programming. This is a warning label for parents so that they have the opportunity to know what their children are connected to, what the content is, and to set some parameters around that. Our prevention team is working to convene mental health experts and teens to identify ways to address the challenges and opportunities that social media presents to youth in Ohio. This work will include engaging families, schools, and community organizations to widely share best practices for helping build the skills needed to safely use social media. So excited to see this work included in the budget. So with that, I want to thank all of you and each of you for being partners and advocates in this work. Your perspective, your input was invaluable as we work together to ensure this budget meets the needs of Ohioans. We trust you each see that the Ohioans you serve are reflected in this budget. It's Ohio's time and we have work to do, but today we're just going to take a breath and celebrate, right? Lots of great work has been done. We're building on a strong foundation and we have incredible and unprecedented opportunity with this budget. We'll continue to do this work together. We do have some time left for questions, so I'm happy to have some conversation there. Please enter any of your questions in the chat. Nicole will share them with us. If we're unable to address those at this time, we'll be happy to follow up with you personally. And of course, more guidance will be coming out broadly as we move forward with implementing these initiatives in the budget.
Good afternoon. First, I just wanted to say that the recording will be posted to our website listed here, mha.ohio.gov/budget by the end of the week. Our first question comes from Precious Stubbe of Hancock County, saying 30 new beds is fewer than originally proposed. Do you know where those beds will be located?
Yeah, it is fewer than originally proposed. We just came short of the operating dollars that we needed for the full expansion of the 80 beds. The 30 beds will be affiliated with our new location, our new hospital being built here in Central Ohio. So it will, those will be here in Central Ohio.
Deanna Veitz from Brown County asked, is hospital capacity expansion for forensic or just for civil beds?
So we haven't designated beds, forensic or civil at this point. We don't have a set aside for any of those here in Ohio. our goal is to continue assessing need and to meet the needs of constituents throughout the state.
Jasmine Long asked, is there anything specific to pregnant and postpartum moms?
So this budget largely focused on resources that complement the federal funding that we have. And most of the resources that we have for pregnant women and moms are coming to us through our federal dollars and the block grant there, or the state opiate and stimulant response dollars available to us as well.
Dr. Meehan said, thank you, Director Chris and everyone at MHAS for your leadership and commitment to the mental health and wellness of everyone in Ohio. Presha also commented again, this budget is an example of what can be achieved with vision. Thank you for your leadership, Director Chris. Kimberly Ferrier said, great news on RSS. Gloria Liddell asked, when will the RSS increase go into effect?
You know, that's a great question, Gloria. I don't know the answer to that as I sit here today. So we'll get back to you and look for guidance on that from our team.
Chelsea Woolard asked, back to vetoes, can you talk about MCDC D67 direct care payment rates, which was also veto number 11? There were funds for community behavioral health in that section.
Yes, that was a technical veto related to how the language was put into the budget, which created challenges for implementing the potential rate increases that were affiliated with the budget. So the veto is more about the mechanism for delivering rate increases, and it was a technical correction to that.
Deanna Weitz asked, will OhioMHAS fall under the new Children and Youth Department?
It will not. There are several programs that are headed to the Department of Children and Youth. OhioMHAS is not one of them. And we'll have a separate briefing on that department and be able to share more with you about what will be managed through that department, who will be leading it, and the timelines affiliated with the transition plans for all of that work.
Raven Oglesby asked, can you tell us more about the new requirements with the October dates?
Raven, if you could type in a little more specific question, that would be helpful. I will just generally say that with all of the policy initiatives that are in the budget, specifically those related to licensure and certification, our licensure and cert team and our legal team and policy team are working to modify any of the rules that are necessary and create policies, procedures, and fact sheets for all of our community partners so that you can see the path forward in the new requirements. So the detail of that may be something that is coming to you very soon, Raven.
Lori Watkins asked, will Strong Families Safe Communities applications be under the new Department of Children and Youth, or will it remain under Mental Health and Addiction Services?
Strong Family Safe Communities is one of the programs that will be in the new department. We're continuing to manage it here during the transition, but it is one that is part of the new department.
Deanna Weitz asked, with the 10% increase in Medicaid rates, how will the additional $77 million from the House be incorporated, and is this a phase-in or immediate rate change?
Yeah, so more to come on that, Deanna. The budget had some pretty significant changes to Medicaid, and so we're still working through with them what all of that means and how that will be implemented, and so watch for more information in the coming weeks on that.
And at this time, that looks like it's our final question.
All right. Well, again, thank you all so very much. We appreciate your enduring support, your enthusiasm for this work, the constant contact that you had with the General Assembly to help them truly understand the work that was needed and the investments that were needed to get it done. I also want to thank you for all of the collaboration and the partnership that is on display. It really does increase the confidence in our system to be trusted with this level of investment to get the outcomes that our community members, the taxpayers are looking for. It's so easy to stand up and really, lead that charge for what's needed for this community because of the partnership that all of you offer and the excellence with which you do your work on a day-to-day basis. So I want to thank you for that, truly, truly. We will be rolling all of our funding and all of this policy work out over the next 45 to 60 days. More will follow along after that. So I appreciate your patience over the next week or so while we get our feet on the ground, really comb through all of the final policies and allocations and get the level of detail that I know that you're needing in order to implement the work. We'll get that out to you quickly, but we want it to be thoroughly reviewed and accurate when it comes out. So we appreciate your patience, but look forward to diving into this important and exciting work with all of you. I hope you have a great rest of your day, a good restful weekend, and get ready to dive into this work moving forward. Thanks.